Welcome back to What the Study Says. You know, if you've ever had low back pain, you are definitely not alone. It's one of the top reasons people end up at the doctor's office. And look, when that pain hits, you just want relief, right? And you want it fast. And that leads us to something you've probably seen all over the internet. Those videos with the dramatic twists, the super loud pops, and then that look of pure instant relief. It's so tempting to think that a quick crack could be the magic bullet for all that aching. But what does the science actually say? Let's dive in and find out. Okay, first things first, let's get on the same page. That whole back cracking thing actually has a formal name, and it's not just one single technique. We're going to pull back the curtain on what's really happening during these treatments. So it's called spinal manipulative therapy, or SMT for short, and you can think of it as an umbrella term for any hands-on treatment that's done by trained professionals, like chiropractors or physical therapists. The main goal is usually tackling low back pain, but how they do it can look pretty different. And that brings us to a really key distinction. Under that SMT umbrella, you've got two main approaches. On one side, you have manipulation. That's the fast, high-velocity thrust that gives you that famous pop or crack. Then, on the other side, there's mobilization, which is a much slower, more gentle, passive movement of the joints. Both are SMT, but trust me, they feel very different. All right, on to the million-dollar question. Does any of this actually work? Well, when you dig into the research, it turns out the answer really depends on one crucial thing: how long you've been in pain. Let's start with acute pain. That's a new injury, something you've had for less than 6 weeks. A major analysis of a ton of studies found that, yeah, SMT was linked to some modest improvements in pain and function. But here's the catch. While it did seem to help a bit, it wasn't any more effective than other standard therapies or even sham treatments, which is basically a placebo. Okay, but what about chronic pain? You know, the kind that sticks around for more than 3 months. Here, we've got some really high-quality evidence. And what it shows is that SMT gives you pretty much the same results as other standard therapies, like a good exercise program or physiotherapy. This makes it a totally valid option, right on par with the other treatments your doctor might recommend. So, to kind of sum it all up, for a new injury, SMT might give you a little bit of short-term relief. For that stubborn chronic pain, it's a reasonable option that's about as good as other standard treatments. It's a tool in the toolbox for sure, but it's not a magic bullet. Now, effectiveness is only half the story, right? Every single treatment out there has potential risks, from taking an aspirin to having surgery. So what are the potential downsides we need to talk about with spinal manipulation? Well, it turns out minor side effects are actually really common. Several large studies show that somewhere around half to 2/3 of all patients will have some kind of minor temporary reaction after treatment. And when we say minor reactions, we're talking about things like feeling a bit more sore or stiff, maybe getting a headache, or some discomfort that radiates out a bit. But the key word here is transient. These are usually mild effects that go away on their own in a day or two. So that covers the common stuff. But what about those really scary stories you sometimes see in the headlines? The rare but terrifying ones about stroke or serious injury, especially linked to neck manipulation? The most serious concern, by far, is something called a cervical artery dissection. This is a tear in the wall of one of the major arteries in your neck that supplies blood to the brain. A tear like that can lead to a stroke, and it's actually a leading cause of stroke in adults under 45. In this slide, this gets right to the heart of the debate. A big, well-designed study found a very strong statistical link. It showed that patients who had a stroke from one of these artery tears were almost 12 times more likely to have recently had neck manipulation compared to patients who had a stroke for other reasons. That's a powerful, hard-to-ignore association. But, and this is a huge but, association isn't the same thing as causation. A major scientific statement from the American Heart Association and American Stroke Association really clarifies this. They acknowledge the link, but they also state that right now there isn't enough biomechanical evidence to prove that the manipulation causes the tear. This leads us to a classic chicken or egg problem. You see, one of the main symptoms of an artery tear as it's developing is neck pain. So it's totally plausible that someone with a tear already in progress goes to a chiropractor because they're in pain. In that scenario, the therapy didn't cause the problem. The problem led them to the therapy. We just don't have a way to know for sure which it is. So, okay, where does all of this leave us? We've looked at the evidence from some major studies and reviews. Now let's try to put all the pieces together so you can weigh the pros and cons for yourself. All right, here are the key takeaways. For new, short-term pain, the benefit is there, but it's pretty modest. For chronic, long-term pain, it's a solid option that's on par with things like exercise. You should expect that minor, temporary soreness is pretty common. And finally, that scary risk of stroke from a neck artery tear, well, it's statistically linked to neck manipulation, but it is extremely rare, and we can't definitively say the treatment is the cause. So ultimately, the decision really comes down to a personal calculation, a conversation between you and a healthcare professional you trust. Knowing that the benefits are likely to be modest and that serious harms are rare but still possible, is that a trade-off you're comfortable with? And that's our look at the research. Thanks for watching What the Study Says. If you found this useful, please do subscribe and share it. It really helps others separate the actual science from all the spin out there. We'll see you next time.